Most people call me Dr. Mark. It's a little more informal. It's been my nickname since the late 80s, so I'm used to it. The only thing I have ever wanted to do is be a physician. My family's physician was always my inspiration. At 4 years old, the only Christmas gift I wanted was a little doctor's medicine bag. I started medical school in 1982, pretty much around when HIV started getting more and more media attention. I came out in 1977, and back in the dark ages in 1982, you weren't out of the closet in medical school. Just the opposite. So I knew myself that I was gay and that I wanted to primarily work with patients with this new infection that was coming around. I was out in the bars one night and I asked a friend of mine if he knew any gay osteopaths. And he was like, yeah, our physician is, and he's gay, and here is his information. And I contacted Tom Martin, who I worked with in my third year of medical school, and he had patients with this new infection that nobody knew what to do with. My parents are in their 80s. They live about an hour away from me, and with COVID, I'm not allowing them to leave the house. So I am doing their food shopping for them. During the week, I am pretty much doing 10 to 12 hours a day doing patient care. I still carry a large number of patients who have HIV, so I'm treating one pandemic during a second pandemic, which is a little challenging. I am also married, still in the process of bringing my partner over from Russia. We've been married now for 5 years, and he just came down with COVID in Russia, so that's a little stressful. It's a very good example of avoidance behavior. If you don't think about it, you deal with it and you bury yourself in work. So I think that would probably be one of my survival techniques if I would be bluntly honest. I know enough to avoid COVID, and I'm doing my best to limit outside exposure. I am living alone until I get my husband over here. I don't consider myself essential. I mean, they use the phrase essential worker, and I certainly think that during a pandemic like this, a supermarket worker is equally as essential, as are the truck drivers who are bringing in the supplies. It's my second pandemic. I've been doing HIV care since 1988, so you just kind of learn to go with the flow. I was actually saying to somebody the other day that when you're looking at the present administration and their denial of it, it has a lot of similarities to the early 80s. Reagan never discussed HIV, but that has not affected the spread of this infection the way that Trump's negligence has affected the spread of this infection. Every year, there are about 40,000 new HIV infections. But that's what we are seeing every day with COVID. It's the same continuation of what fueled me back in the 90s, to do right by my patients. They were pretty much abandoned. They were the lepers of modern society, and yet HIV patients needed just as much care as everybody else. Here we have COVID patients, and when you look at it, they're put in a room in a hospital with no visitors. Nobody's allowed to go and see them. That was not that dissimilar to the early 90s, where family members were too ashamed to go and visit their child. We had people with AIDS dying by themselves in the hospital, and we used to put on the same full suit to go around an HIV patient because there was fear and concern and ignorance. And still, there is a lot of fear and concern and ignorance about COVID. I guess the best thing we can do is educate people, and knowledge is power. We do not live in a bubble. We do not think about how we affect everybody's life in that aspect. There was that realization in my generation of realizing how many people you impact with an STD being the example. This disease is not sexually transmitted, but you could still infect somebody who's on their way home to their grandmother, or a family member who is diabetic, or who is on dialysis. We do not stop and think about that, and that is what we need to do. I performed a couple COVID tests, and that weekend I had to take food up to my parents. What I do is I open the garage door, you stand back, I'm going to put them on the floor, and then you are going to carry them in. My mother goes, "I cannot even hug my son?" And I say, "No, get away from me. No, you can't. That's difficult." But I think it has made my parents more dependent on me. In that aspect, it has brought us closer together. I do not see my neighbors anymore. I don't really see my friends either. It's all phone calls or meetings like this. I do miss my coworkers. You feel isolated when you're doing your 2 weeks at home. By the end of the 2 weeks, I'm ready to go back into the office again. By the end of the 1 week in the office, I just start getting paranoid about COVID, and all I can think about is running home. Probably still to be determined. You either deal with it or you get bent out of shape over it. I understand that there is a lot of COVID anxiety. I understand that a lot of people have increased their alcohol intake, or some people may smoke a little bit more weed to calm themselves down. Whatever works for you. People need some kind of coping mechanism, and mine is to stay busy. Does mankind ever learn? If you look, there's been enough epidemiologists and public health professionals who have been talking about this for the past 10 years. There have been articles in medical literature talking about how we have a big flu pandemic every 100 years, and we are due for one. The last big one was 1918, and if you read the history of that pandemic, people got fatigued. There was a big party in the streets of Philadelphia, and that became a big resurgence, and there was a second wave. Did we learn from that? I hope we learn to trust the scientists again. Let's hope we learn a lesson and wise the hell up. We have a brilliant man in Dr. Fauci who did a lot of work back in the HIV pandemic. He has the experience, the knowledge, and the leadership ability. And yet people completely distrusting and discounting him. Death threats. A public servant in public health receiving death threats. I am angered beyond belief. I am furious. It is a global embarrassment for this country. Fortunately, the majority of my patients are much more intelligent and do not listen to him. I have had patients ask intelligent questions about masks, and if you sit there and discuss it, most people understand. I do have patients who are supporting, I do not even like to say his name, 45. And that is their prerogative. They are still aware of science, and COVID issues are separate from why they support him. Yes, I have been in the supermarket, and I guess I should learn to hold my tongue because I have lashed out at a Karen who was saying that masks are completely worthless, and I politely told her that is bullshit. You know, people say we are never going back to normal. I still question that. Why can't we go back to shaking hands and hugging friends and whatnot? If enough people get the vaccine and we achieve herd immunity, which is a medical term applied to vaccinations and is frequently used incorrectly. To achieve herd immunity, you need at least 70% of the population to be infected with a disease. And even if it is 0.1% of people dying, you are still looking at millions of people. We realize that this is most likely going to be back every year like the flu, but that does not mean we cannot return to some form of normalcy. Return to normalcy will not happen overnight, though, and it will not happen in 2021. I do not like when people say, living in fear. No, it is not fear. Knowledge is power. Being aware of your surroundings and wearing a mask is not a sign of fear, but a statement saying, I am living my life with precautions.